So today we are going to talk about monosaccharides. Monosaccharides structural aspect. So basically, whatever important thing we'll discuss that only. Seritoisomerism is an important character of monosaccharides. Okay, it is a character of monosaccharides. What is seritoisomerisms? Are the compounds that have the same structural formula but differ in their spatial configuration. Okay, means here we are going to understand about that. It is about structure. Structure is same, but their appearance is different. Okay, this is the difference between the meaning of stereosomism. Okay, it is the character of monosaccharides. Okay, monosaccharide have same structure, but when you are going to uh, understand those structures, there is a difference. Okay, so you know that there are the four atoms. Okay, in the carbon. Okay, all these are the about structural things. Okay, these are the shifts about structural things which are not important for us. Everything is that there are D glyceridide, L glyceridide, D glucose, L glucose are the structures of those monosaccharides. Okay, all these are structures. So here the only glucose structure is given. So let's talk about that. For a better understanding of glucose structure, let us consider the formation of hemacetals and hemaketals, respectively produced when an anhydride or ketone reacts with alcohol. Okay, these are the structure about sugar. Okay, all these are structural conditions. Mm. Okay, here one thing, glycosides. What are glycosides? Glycosides are also carbohydrate. Okay, it is the carbohydrates when it will reacts with hydroxyl. Okay, hydrogen. Okay, and a group of hydrogen. Okay, so will then if the hydroxyl is not separated, then what will happen? That is carbohydrate. If it is connected with hydroxyl, it happens glycosides. Okay, glycosides bond form, and non-carbohydrate is referred as a glycone. If there is no carbon, then what we'll call a non-carbohydrate. Okay, so what is the functional property of physiological? Okay, why it is important? Glycosides is a glucovinylate. Okay, is a natural substance that imparts vanilla flavor. Okay, like we are getting vanilla flavor by this types of reactions. Okay, by changes in the chemical properties of carbohydrates and or addition of other things which is important. Next, by cardiac glycosides. What is it? It is as a glycoside, but contain the e-glycone steroid and stimulate muscle contraction. Okay, so this is also as used as steroidal glycosides. Next is streptomycin. It is also glycoside. Is an important antibiotic used in treatment of tuberculosis. Okay, cubiane. Cubiane. It is also a glycoside which is inhibits potassium, sodium ATPase and blocks the active transport of sodium. Okay, it is for sodium, calcium channel, sodium and potassium. ATPase means it is present in the cell to production of energy. It blocks those channels. And Fluorescein produce renal damage in experimental animal. So these are the glucosides. So we have to know that what what type of monosaccharides is using as a eating agent. Okay, we have flavored like substances, we have steroid like substances, we have antibiotic like substances, we have inhibitants which are like monosaccharides in the glycosides form. Okay, and fluorohizin, all these are can these are using. Okay, so I have understood that what is the main use. So fluorohizin, it will damage the renal, means kidney. Okay, kidney. What are the derivatives of monosaccharides? From monosaccharides, what will production will happen? Okay, well, here they given sugar acids, sugar alcohol, aldetodes, amino sugars, deoxy sugars. Okay, deoxy sugar. Okay, in that they will add some any material, any element, so it will convert. So here oxidization of primary alcohol group in monosaccharide results in sugar acid. Gluconic acid produced from the glucose by oxidation of aldehyde, where gluconic acid is formed in primary alcohol group is oxidized. Means that whenever the sugar molecule, carbohydrate molecules get oxidize, mainly uh, hydrogen molecule, CH2O. Okay, so the hydrogen molecule is hydroxidized, so it will convert into sugar acids. Okay, sugar alcohol. Okay, here the production of more hydrogen ketone bodies. This, okay, it is also a form of monosaccharides. Like we have mannitol from mannose, sorbitol from form glucose. These are the drugs. These are the medicines which are used in the sorbitol is used to widening the arteries during heart attack, and mannitol for decrease the pressure in the brain. Okay, these are the sugar alcohols. Okay, next we have aldetols. Aldetol is also monosaccharides. Okay, they are the chemical reactions in the carbohydrates. Then it convert into aldetols. Okay, it have coenzymes like glycerol. We use glycerols also, na, for any type of sore food, sore tongue. Likewise, amino sugars. Okay, it is also monosaccharides. Here, the addition of amino groups. Okay, it amino groups. So that's the reason in form of amino sugars. Like we have D-glucosamine, D-galactosamine, constitution of hetero. Okay. Next is a deoxy sugar. This is a sugar in that we have less oxygen is there. CH2O. Okay. Oxygen will replace. Okay. Will replace. One oxygen will less. What will happen? Like lactose. Okay. L-ascorbic acid. This is also will produce from the prepare from the monosaccharides. Vitamin C also. Okay, this is water soluble. The source which close resembles that of monosaccharides. So you can make all these derivatives, all these things from the monosaccharides. So in this chapter we learned something, but not completely. Only structure, simple structure, and what are the types of monosaccharides, how monosaccharides having a derivatives. This we learned here. Next we have disaccharides. So what is disaccharides? Disaccharides, already we know that we have more than one glucose, 2 to 10. Okay. Consist of two monosaccharides. Like we have glycosidic bond. Okay, they are connected, cannot separate them. Okay, water soluble. Okay, they are water soluble also, disaccharide, and they have sweet taste. Okay, sweet taste. There are two types: reducing, non-reducing. Non-reducing means they are free, like maltose, lactose. Okay, they are free. They are free disaccharides, but they are no free aldehyde or keto group. Like example, sucrose, terhalose, maltose, lactose. One group they are reducing. Non-reducing we have sucrose and trihalose. Okay, so we'll discuss everything here. Maltose, sucrose, lactose also. Okay, what is maltose? Maltose is a compound of two alpha D glucose units held together. The freely aldehyde group presents C1 of second glucose answer the reducing reactions beside the zone formation, sunflower shape formation. Okay, means here in that alpha D glucose is there in maltose. Okay, this is the difference between alpha. Sucrose have D alpha D glucose and beta D fructose. In this, the we have disaccharides. Na? So in that there is another uh, combination of fructose has come in. Okay, in the sucrose, lactose having same alpha D glucose, but sucrose having different type of glucoses, alpha D and alpha beta D fructose. Commonly, we will call sucrose as cane sugar also. Sugar cane having sucrose. Okay. Sucrose is an important source of dietary carbohydrate. Okay. Whatever you are using, it is the derivatives of sucrose only. Okay. I will discuss that thing. It will come. It is sweeter than most other common sugars. Okay. Except fructose. Fructose is more sweeter than sucrose. Okay. And namely glucose, lactose and maltose. We discuss maltose and lactose now. Sucrose is employed as a sweetening agent in food industry. So sucrose is used in food industry. The intestinal enzyme sucrase hydrolyze sucrose to glucose and fructose, which are absorbed. Okay, so whatever we are using, you are taking sucrose like sugarcane juice. It will convert into glucose and fructose. Okay, so this is the thing we have to remember about sucrose, maltose, and sucrose. Maltose is a low level or only two type of glucose are there: alpha D glucose, beta D glucose. Next, we have sucrose. The sucrose we have alpha D glucose and alpha beta D fructose. And it is most of the sweets, whatever we eat, we use, it is the derivative of sucrose. Okay. Next, we have lactose. Maltose or lactose. Lactose is milk sugar. Okay, whatever present in the milk. Okay, this is the sugar of milk sugar also. What type of uh, sugar will present? Beta D galactose and beta D glucose. Beta D galactose and beta D glucose are there. Okay, this is very important thing we have to remember. Next, we have lactose. Lactose. So we have fructose, maltose, and lactose. Maltose, sucrose. Okay, maltose and sucrose. And we have sucrose and lactose or lactulose. These are the second non-inhibition, non-reducing sucrose and terhalose. So it is a milk sugar. Okay. This is lactose of milk is the most important carbohydrate in the nutrition of young mammals. It is hydrolyzed by the intestinal enzyme lactase to glucose and galactose. So we have some intestinal enzyme which convert those glucose, or what we will call we'll call lactose, okay, into by the in the intestine by the uh, intestinal enzyme. Okay, this is very important. Which enzyme converts lactose to galactose and glucose? That is enzyme lactase. Next is lactulose. Lactulose is a synthetic dessicant containing galactose and fructose. So it is a combination of galactose and fructose, galactose and fructose, galactose and fructose, galactose and fructose. In neither digestion nor absorption in the intestine. Lactose is useful for the treatment of hepatic encephalopathy, a disorder of characterized by involved plasma ammonium level. Lactose converts ammonia in the lumen to ammonia to NH plus 4 positive. This result is reduction of the plasma NH3 since 9.4 ions are not easily absorbed. So lactose is very important. Okay, for digestion we doesn't need lactose. Okay, lactose is not is there. Okay, and digestion not absorbed in the intestine. So what will happen? It convert, and galactose or lactose. It will convert ammonia, whatever hard substance ammonia. It will convert. It will make the cell into 9.4 or 9. Converts ammonia. Okay, who converts lactulose converts ammonia also. NH3 in the intestine. So whenever the hepatic encephalopathy means liver infection. So whenever patient having liver infection, so there are chances of giving lactulose, because if the reason behind the infection is glu lac is sorry is infection is in the liver due to hepatic encephalopathy. Okay, we confirmation is then we give lactulose. Why? Because it will make the plasma in the plasma ammonia reduction. Okay, so today we'll talk about disaccharide and monosaccharide. So another topic we have that polysaccharide. In polysaccharide we will discuss other things related. After that we have heteropolysaccharides. So any doubts? Kindly ask.